Linda Vail, Ingham County Health Officer.
My first question is, although people need to call ahead of time and not come to the drive-through site without calling ahead, if a person was close by, could they make the appointment with the proper preparations to come get tested?
We have to have people call ahead. I know, for example, the Sparrow drive-through won't even test you unless you drive through with an order. So just showing up could end up with you just being turned away.
My second question is on the website as well, was bring your phone and your insurance card. Is the reason for that to let them know when the patient has arrived for testing?
Basically, to avoid, unnecessary person-to-person contact, we want to be able to communicate with people by phone. So basically having their cell phone with them and having their provider care number so that they have a correct number on file allows us to, follow communications. So that's part of it. Clearly, having your insurance card is the way people are able to bill for those services.
My third question is, the website says that not everyone who wants a test will get a test. For many with mild to moderate symptoms of COVID-19, tests may not be necessary. However, anyone with the symptomatic fever, respiratory symptoms, cough should be self-quarantining and monitoring themselves at home.
Correct.
Contact usual healthcare provider if you are sick or have worsening symptoms to stay home. What if a person does come down with it and doesn't have a healthcare provider?
If they don't have a healthcare provider, they can reach out to an urgent care. So that is one resource. That's my best option at this point in time, is reach out to an urgent care. Ready Care in Okemos is doing drive-through testing and has been doing a lot of work related to this. So if you don't have a healthcare provider, the ER is not the place for this right now. If you're at home and you're doing well and you're just calling to get some reassurance or some direction from a healthcare provider, if you are experiencing severe symptoms, that is, you are unable to keep food down, you are unable to keep water down and stay hydrated, you are experiencing a fever that you cannot control with over-the-counter medications to control fever, and you are short of breath to the extent that you can't have a fairly brief, simple conversation in order to talk to somebody, then those are the cases where you need to make a call and seek immediate kind of care.
One of my other questions is, I know with the outbreak there's social distancing going on as well, even though I know you just mentioned that with one of the questions before, and since you brought up Sparrow Laboratories, I know they're offering a drive-through service for blood draws and non-other COVID-related labs. With that being said, how is doing that promoting social distancing?
It keeps those folks from going into a satellite laboratory, which could be very small, or for going into the hospitals where those lab work are typically done. Keep in mind, we're keeping people out of hospitals at this point in time, no visitors, that sort of thing. So it is keeping people separate. It is providing necessary testing and blood draws that may be ordered right now in a way that is safer.
The Ingham County Health Center is able to provide an over-the-phone patient registration and assessment by a provider and accepting all insurance, no insurance, Medicaid, Medicare, and providing service regardless of ability to pay. What if the person doesn't have the exact amount? Can the person do monthly payments?
We are providing service without regard to ability to pay, which means if you don't have a way to pay, you will still get tested, you will still get treatment.
And I guess my final question, is there anything you would personally like to say to anyone that, has symptoms, needs to get this information, or needs to come in, or even like you said earlier, a healthcare provider, seeking their help for symptoms? Is there anything you would personally like to say?
Just, helping people understand that, testing is not always necessary. Similar to, when we have flu season. Not everybody gets a rapid flu test. They just kind of accept, I have all the symptoms of the flu, I'll stay home while they're sick. Some people do that, some people don't. We wish they would always do that. We certainly want people to do that with this. So it's important for people to understand that not only is testing somewhat limited, although expanding rapidly, but testing people with mild to moderate symptoms who could simply stay at home and stay self-isolated and monitor themselves at home for serious symptoms if they should present is the best way to handle that right now. Not only is it keeping us from using a test when it all it's doing is telling you you have or don't have COVID-19. You may test for flu and you still need to stay home, with no cure, with no vaccine, with no specific treatment. We're treating symptoms. We're not treating a specific disease. So testing for that specific disease is not about clinical care. So the other thing that happens, though, and it's important for everybody to know, every time we test someone, our staff and staff anywhere put on personal protective equipment. They put on a mask. They put on gloves. They put on that face shield. We know those things will start to get in short supply if our hospitals get overwhelmed. If we use our PPE, personal protective equipment, right now for a whole bunch of tests that didn't really need to happen, then what we will do is burn through a lot of personal protective equipment. And then when and if we get more and more serious cases in our hospitals and we start to run short of our healthcare workers being able to have them, then they're more at risk of getting exposed and getting sick if we don't have enough. And then we have the possibility of too many healthcare workers getting sick and not having enough of them at work to do all the work that's going to need to be done to keep people well, to keep serious illnesses under control and help people recover and get released from the hospital, which is happening. So people who are getting into the hospital and getting care for serious illnesses right now are basically getting that care, and many of them recovering.